Hello, everyone. Nice to have you today on this Monday evening to have this open conversation about egg freezing. So, I'm your host tonight. My name is Anastasia. I'm a co founder and CEO of Blooming Eve, a women's health platform specializing in egg freezing. We help you to navigate through egg freezing process, optimize the costs, find doctor and the clinic, and get an expert support from the community. Today we have an amazing list of panelists. I want to introduce you first to our medical expert, Dr. Shvesa Zarek. Dr. Shvesa, um, he's a double board certified and award-winning reproductive endocrinologist that has more than 15 years of experience in reproductive medicine. She served as a director of IVF and an assistant professor in the Division of Reproductive Endocrinology and Department of Obstetrics and Gynecology at the University of Missouri before joining Oma Fertility in St. Louis as a medical and practice IVF director. Welcome, Dr. Zarek. We are
Thank you
glad
so
to
much.
have you tonight. We also have two amazing guests who did egg freezing at different moments in their lives and agreed to share their experiences with all of us tonight. I want to introduce you to Tamina Stoll. Hi, Tamina.
Hi, Anastasia.
She's a gender equality and women's health advocate, B2B marketing and sales whiz, content creator, speaker, personal finance coach, startup advisor, and investor. She is a member of the global leadership team at Women at LinkedIn and a host of the Give Her Dollars podcast. In 2022, Focus magazine recognized Tamina as one of Germany's 100 most influential women. Tamina froze her eggs in 2022 when she turned 28. And the last but not the least, Dana Kaplan is a renowned educational coach for neurodiverse and out-of-the-box learners. As an award-winning retired classroom educator, certified trauma specialist, and coach for neurodiverse learners, Dana is celebrated as a renowned international educator for the world. After over 2 decades of education focusing on holistic brain health, Dana founded Developing Empathetic Education with Dana, where she is disrupting the current educational paradigm by reforming, reframing, and rebuilding a courageous, compassionate, and expansive learning arena that is accessible and inclusive for all. Dana started researching egg freezing just before her 32nd birthday and completed the procedure in 2010. I'm glad to have you all tonight. Thank you so much for joining us. Before we start, I want to do a quick poll to learn a little bit more about our audience. So I just want to ask you one question. Where are you in your egg freezing process? So all the attendees, you should see the question right now. Please choose the most relevant answer. We'll wait a few seconds for everyone to vote. Okay. Yeah, so most of our guests want to do that, not yet sure when. So we have a lot to educate everyone about. That's amazing. Okay, so let's start. I want to start with you, Dr. Zarek, and the medical perspective. So I know that you want to share some slides with us. So let me go ahead and pull up the slides. Okay. So can you see my screen?
Yes.
Okay, so tell us a little bit more about the process and what it is. How does it work?
Yeah, absolutely. So first, thank you so much for that great introduction. I'm just super thrilled and honored to be here with such amazing women. It's just, really just fantastic. And so it's great to have a poll to talk through where everyone is in this process. And my role here today is to answer any and all questions that you may have. And, if there's like an anonymous box, you're welcome to put in questions that way. But really, it's a chance to talk to a fertility specialist. As Anastasia said, I'm a board certified reproductive endocrinologist. I truly have a mission of making sure that women know about this option. When is a good time? That's always a question that we get. So let's talk a little bit about egg freezing. So IVF was started around 1978. It was developed probably a good 15 years before that, but the first IVF baby was born in July of 1978. And then there was a big gap. During that time, there was mouse oocyte vitrification, which is just the technical way to say that mouse eggs were frozen. But it wasn't until 2013 when ASRM released experimental status from egg freezing. And I remember it very clearly. They did a very good kind of PR timing. They timed it to our big conference in October. And I was a fellow at the National Institutes of Health. And it really just completely opened up this world of what we could do as fertility specialists to support family building overall. Next slide would be great. So, you hear about the biologic clock. So let's talk a little bit about human oocytes. They're the biggest egg in the human body. You cannot see them with the naked eye still. And they are actually made when you are in your mother's womb. And so we start with about 1 to 2 million oocytes. And even before you're born, that 1 to 2 million decreases to somewhere around 200,000. So there's a decrease. And that's kind of the theme, is that we start with our highest potential, and then you see the egg quality and sometimes quantity drop off. During the reproductive years, so we say about 20 years, of those 200,000 eggs, every woman releases probably only about 400 to 500 of those oocytes. And usually it's one oocyte per ovulation or menstrual cycle. So what you're seeing here with this graph is chances of getting pregnant or conceiving by age within 1 year. And fertility or infertility is defined as attempting conception with regular menstrual cycles for longer than a year. So you can see it matters whether you're 20 or you're 40. And so this is why it's so important to get this education out there, so you feel like you can make the best decisions with all the information you have. And it's hard to predict what the future looks like, but you certainly can say, I know this information and I have this tool to help build my family. So in terms of when is a good time to consider egg freezing, generally, mid to late 20s into early 30s is kind of the best time overall. The peak egg quality is somewhere in the late 20s. Between 30 and 35, it's pretty steady. And right around 34 to 35 years old, you start to see a drop off in egg quality. If there's one piece of information, and I had no other, about someone coming for a consultation, it would be their age, because that is the best way for me to kind of counsel you in terms of what are the chances in terms of number of oocytes to have a live birth. They've defined AMA, or advanced maternal age, as 35, but really there's still time. So really the egg quality does not truly decrease from what we see doing, IVF day in and day out until about 38 and a half. And about 38 and a half, still we have some really good rates. So you can see that between 30 to 38, there's a window where everyone is kind of affected differently. And that's why it's a very unique case. Next slide, please. Thank you. Okay, so these are the top reasons to freeze your eggs, and it can vary, and it's extremely personal. It comes with your own story, your cultural background, kind of, maybe what your family thinks, but really it's maybe you're not ready for kids yet. You're not finding the right partner, or having health issues that might affect your future fertility. And I've certainly kind of supported women with all three, one of these three choices for sure. But the main, kind of thought is that I truly view egg freezing as kind of the ultimate self-care for women, for working women, for professional women. So you don't have to worry so much about when. And so this is kind of taking that when portion of when to have kids and when am I going to find the right partner, out of the equation a bit. May I get the next slide? Thank you. So let's talk a little bit about the egg freezing phases. If someone comes today and says, I'd like to start this process, it actually can go pretty quickly. It's really a matter of if you're mentally ready. But with the first consultation, we do some initial blood work to get a sense of what your egg count is like. What that tells us is really how to dose your medications, and then an ultrasound to get a general sense of the kind of internal anatomy. Um, I've done a number of egg freezing cycles in somewhat of an emergency for women with a new breast cancer diagnosis, and so it really can happen quite quickly. The medications, you go to the next part with start of your cycle. The medications that are used are generally stimulation medications. They are safe. They're hormones that your body is already making, like FSH. And think of FSH as kind of food or calories for these eggs, which are housed in follicles. Follicles are the individual homes for each egg. So the more calories we give with these medication injections, the more follicles have a chance to respond. And so usually we sometimes actually use birth control pills for a little bit, and then we start this medication, the injection medications, and you're on that for about 10 to 12 days. So that takes you to part 3. During that 10 to 12 days, and we teach you how to use injections, you're coming in for maybe about 2 or 3 ultrasounds. And then there's a one-time medication called a trigger shot. And what that does is it triggers the body to start those eggs to go to the final steps of maturity. And if we waited and didn't do an egg harvesting, you would actually release or ovulate those eggs. So the actual retrieval is the kind of the more intensive procedure. It's timed close to that 36 hours before retrieval. It's usually timed around 35. It's about a 20 to 40 minute process. You're asleep for this, like at a dentist's office, breathing on your own, conscious IV sedation. And so general is usually when there's a breathing tube down your neck, and that is actually generally not used so much unless there's some mitigating circumstances. Overall, you'd be breathing on your own. And the reproductive endocrinologist performs this under ultrasound guidance. So it's an ultrasound wand, and there's a needle. It's long, but it's tiny, and it's connected to tubing. And think of those follicles as individual homes for each egg as kind of like small water-filled balloons. And each ovary is a collection of those water-filled balloons. And so when I place that needle with ultrasound guidance into that balloon, so to speak, or the follicle, that follicular fluid is then drawn out into a test tube. And then with that, we look underneath the microscope for the follicular fluid to identify the egg. So it's a very easy, rapid, safe method to harvest the eggs. You wake up, feel a little bit groggy. Usually, I say go home and sleep. And then from there, we usually let you, we'll check in terms of, how you're doing pain-wise. And I'm happy to answer any questions about how much pain there is related to it. It is still considered minor surgery. So how many eggs to freeze? Well, we will freeze as many as we can that are mature. So that's important for the maturity of the eggs. It's very age dependent. So average, yes, we say about 10 to 20 eggs are retrieved during one cycle, but it may be that you have a lower egg count, but that's okay because a lot of it depends on the egg quality. So here you're looking at talking about a woman under the age of 35. Let's say she goes through the egg harvesting and there's 17 oocytes that are thawed. 14 of those are mature. The mature ones are the ones that can be fertilized. So then they're fertilized with the sperm. Let's say 10 of those eggs fertilized properly. They are generally grown, those embryos now, for about 5 days, and we get 3 embryos. One, and then they may be tested for their chromosomes, and 2 are chromosomally normal, and it's the chromosomally normal ones that can be implanted, and then 1 is implanted. So this is a very natural kind of attrition or drop off that you can see. Remember, we started with 17 and we got to 1. So there's some really good studies out that show kind of between age of 30 to 34, you generally need about 14 high quality eggs for a very good percentage of having a live birth. Between 35 to 37, that goes to 15. So there's not much of a change. And then 38 to 40 is when we need a lot more oocytes to get to a healthy pregnancy. And that's more 26 to almost 30 eggs. So that's why however many you have, we will retrieve. But what matters then is depending on age, it may be how many times we recommend repeating the egg retrieval.
Success rates.
Yeah, so this is what we were kind of talking through overall. It's very age dependent. And so you can see between, if you look at 10 eggs versus 20 eggs, how much that matters. So with 20 eggs in someone who's less than 35, that's a 90% chance. And success rates, is this live birth? Do you happen to know? It may be positive pregnancy overall. And so from there, you can see it kind of goes down. So the 40 to 44, 43 to 44 is much lower. So 10 eggs is maybe about 8 to 14%, and 20 eggs is about 15 to 25%. So there's a dramatic decrease.
Yeah, so are there any chances to make the procedure, the results better?
Great question. So all of these tips that are up here are true. Not sure about the no showers. You just have to be careful. I usually like folks to be on a supplement called coenzyme Q10. That is known to be very kind of evidence-based to help with oocyte quality. It helps with kind of the machinery within the egg. And so that is the, other than a prenatal vitamin, I like folks to be on CoQ10.
I think that's it.
Yeah, I hope that was helpful. Yeah, thank you so much.
Thank you so much. Thank you so much for sharing with us. Now I want to change the gears a little bit and talk to you girls, because you went through the procedure and we really want to know what was the actual experience. So I would like to start from the very beginning. So what made you decide to do egg freezing? So Femina, can you share how was it for you?
Absolutely. Well, again, thank you so much for having me. First of all, I'm really looking forward to this conversation. So yeah, thank you for creating the space, to dear Blooming Eve team. But to answer your question, Anastasia, so for me, I kind of accidentally fell into egg freezing. So for context, I've been with my current employer for over 4.5 years at this point, and while I knew that I had access to exceptional employee benefits, I actually did not know that they also supported elective egg freezing, because initially I thought that these benefits were limited to employees who were, diagnosed with infertility or another condition that would make it difficult for them to conceive in the future. But then I actually learned about a female coworker who had recently been through the process of elective egg freezing. So I reached out to her to learn more, and she told me that any employee basically qualifies for this benefit. And as you can imagine, I was absolutely thrilled by that news. So did some more research and officially enrolled in my fertility benefits. And, since I'd been dealing with a few issues related to reproductive health, and I'd also been diagnosed with lipedema, which is a chronic illness that is almost exclusively unique to cis women, I'd been on this journey of learning more about women's health and, uncovering systemic discrimination in healthcare, and overall just becoming more in tune with my own body. And then obviously we know with everything that happened last year with Roe v. Wade, it being overturned last year, learning more about fertility preservation just seemed like, I guess, a natural progression of that journey that I had already been embarking on. So that's how I got into this whole space.
Thank you so much for sharing. Dana, how was it for you? Why did you decide to do egg freezing?
Kind of like how it took me to get the screen on. It was kind of like me navigating life independently and trying to figure things out and not really knowing what to do. And jokes aside, I've always been one to believe that our journey is our own journey. And as shared previously, I had been in a relationship and I knew that that was not the right one for me. And I also firmly believe, as an educator, I see it day to day, in and out of the classroom, the commitment and the dedication and the constant go, and you never stop as a parent. And so it was really important for me to take all of that in, both as a citizen, as an activist, and as a female, and knowing what can I do and how much responsibility is it? And so for me, choosing to freeze my eggs was an insurance. It was freedom. It still is. It's freedom. It's my insurance. It's, when I started posting about this event, I have high schoolers now that were in my kindergarten class that are following me and seeing what we're doing. And they're like mystified. I was creating kindergarten medical school, and behind the scenes I was freezing my eggs, and they had no idea. And so it's really about just owning your power as a human and as a female. And to this day, I pinch myself. Like I remember crying to the doctor's office, being like, what am I doing? This is bananas. Everything, everyone, every person, every situation thinks I'm crazy. And I went there and I did it. And it was the best decision.
This is awesome. Thank you so much for sharing that. I believe that we can empower other women to consider this amazing option that our medicine created for us. So can you tell us a little bit about the process itself? So how was it going through it? So can you share, Dana, how was it?
I mean, you can tell by my face, I'm an anomaly. So just backstory, I experienced anxiety. I've experienced it since I was a child. So it was very clear that I was still on my anxiety medication and still having to be very conscious and with my therapist and all of those different components. And as you saw on the screen, it says to limit exercising. And so for me, exercise is really important because I believe in holistic health. It's not just you take a medicine and you're fine. It's you take medicine and you sleep and you eat and you do all the different things. And so I am still mystified to this day that the hormones had absolutely no effect on me. It was a beautiful, beautiful experience. And my wish is that everyone experiences the same. I had zero weight gain. In fact, I think I actually even lost weight, not even trying. I was happy. I did not the whole process was just beautiful. It was a really powerful experience from start to finish. I know I can be an anomaly in this case. But it's also really important that I emphasize the fact that, yes, I still took my medicine for anxiety. I still was responsible in doing all of that. So you can still have these different hurdles that you may have to navigate in the process. And it doesn't mean that the side effects are actually going to be your side effect. It's very independent to everyone's body.
Well, I'm glad to hear that it was easy. Tamina, how was it for you?
Well, I second what you just said. I'm super, super glad to hear that it was overall, empowering experience for Dana. It was a little bit different for me, and yeah, let me just be a little bit vulnerable here with everyone. So, given my age, I'm 28. I thought this would be a one and done kind of deal. I'm a busy woman, and I had carved out those 2 weeks of my life where I wasn't traveling or had any other big commitment, so I could really focus on this process. But then during my initial consultation at the fertility clinic, I learned that at age 28, my fertility had already declined. My doctor had done an ultrasound, and she had told me that given my age, she would have expected a significantly higher available egg count in my ovaries. Not necessarily the type of news you want to hear. I was really convinced that I was ahead of the curve, still being in my 20s, right? So that was kind of a punch in the face for me. And that's why I would say this whole process ended up being an emotional roller coaster. Even though I know rationally that this is not my fault at all and completely outside of my control, I definitely felt embarrassed, ashamed, guilty, angry, disappointed, all the feelings. But eventually I also felt really proud of myself that I took the initiative to start this process in the first place. Like, imagine if I hadn't found out about my fertility already being on the decline until my mid-30s, at that point it might have been already too late. But now I have given myself more options, and I'm actually about to kick off my second round of egg freezing. I'm very lucky in the sense that my fertility coverage provided by my employer is exceptional. They're supporting up to 6 egg freezing cycles, which is incredible. So I'll be doing this all over in like 2 months from now.
Your story reminds us that really not every journey is the same. And to your words, Dr. Zarek, that there is no ideal age, so it's different for everyone. I encourage everyone in the audience really to test and to go to see fertility specialists to know where you are and to understand what you should do. Yeah, so egg freezing is a very serious decision. That's why, girls, I want to ask you about the expectations and the fears coming into the process. So how was it compared to the reality? So I would probably start with you, Tamina, because I know that it was a little bit more complicated than you expected.
Yeah, absolutely. I think overall I was still positively surprised, like regardless of, my individual reproductive biological circumstances. Because initially I didn't really know anything about this process, right? I don't think that our education systems do a good job at educating us about women's reproductive biology in general. So I feared that I would have to dedicate multiple months of my life to this process, which, as Dr. Zarek pointed out earlier, turned out to be wrong. I think it was still an overall like challenging process emotionally and physically. Like I'd never had any issues, with getting vaccinated. I'm not really afraid of needles. But I definitely had a lot of respect of getting injections into my belly. There's a difference between getting a needle into your arm and your belly, that's for sure. But I was also positively surprised, similar to Dana. I didn't experience any side effects aside from being like super bloated towards, the end. Like I was able to still do my job and like perform well. I didn't have any big mood swings. I think I started sweating a little bit more towards the end, but really that was basically it. So I really want to take away people's fear that this is going to be an all-consuming process. Should you be making sure that you can carve out that time to really dedicate yourself like emotionally and physically to this process? Absolutely. You don't want to have any big distractions, but it's not gonna be something where you have to, as I mentioned earlier, like carve out months of your life.
Thank you for sharing. Dana, any surprises from your side?
I think I think I was really anticipating a huge emotional roller coaster ride. I mean, I also at the time there was a lot of other personal experience, like personal pieces going on in my life that, when we make these decisions, and we have to stay so unconditionally focused on ourselves, because the outside noise can take over, and then that can also wreak havoc on our body. So I think for me, it was more of just being, I think I was just still so pleasantly surprised at how neutral I was able to stay through it. And I think also I think the only big surprise that I had really and truly was the psychiatrist and the way that the questions that were being asked to me. I mean, they were just very they were intense. And as an empath, as an educator, as an advocate for all of humanity, I think it's really important that we stay curious when we're asking questions, instead of and check our tone of voice when we're asking questions. And remember, we don't know anyone else's story. I mean, just like Tamina said, like, she's 15 years younger than I am, and I would have assumed that she had the easiest time, right? So the idea of assuming and the idea of going into these situations with an open heart is so important, because we don't know what's going to happen, and we don't know anything. And so just to go into it with just love and hope, and I think is the most important piece. Yeah.
Oh, I love that. So yeah, any recommendations we have in the audience, people who are still thinking. So what would you tell them? What should they do? Tamina, what would you say?
So, to the members of our audience, I would say if you are considering having biological children someday, look, I don't believe anyone should be a parent or has to be a parent, but if you're considering it, please, please, please do yourself the favor and schedule a consultation with a fertility doctor. Even if you're still in your 20s, even if you don't know if you want to have biological children at all, even if you currently don't have the financial means to go through the entire process. I think we've pointed out throughout this conversation that every woman's body, every person who has ovaries, their body is different. Every person's circumstances are different. There is no one size fits all. But knowing what your individual circumstances are will give you the opportunity to make more educated decisions about your own body, because knowledge is power.
I think I cannot agree more with this statement. Everyone should check. This is like going to the dentist. You should go to the fertility specialist at least. Yeah, at least once. Dana, what do you think?
Just echoing everything Tamina said, I think it's so profound how quick we're told, go to the dentist or go to the pediatrician or, go to the gynecologist, but we're not actually encouraged to take these brilliant, bold steps for ourselves. And I remember the conversations that friends were having when I told them that I was freezing my eggs, and they're like, you're so young. And I was like, I don't care. Like, this isn't about being so young. My mom was so fortunate and had 4 children with ease. I don't know if I'm going to be like her. I don't even know when I'm going to want to have kids. I know that I have literally 100 children every school year at this point. I mean, that was when I was in the classroom. So like, you have to have the knowledge and the understanding, and you have to dismantle all of the stigmas and the paranoias and the fears and everything, which circulates back to the fact that I thought that I was going to have all the different side effects. I thought that I was going to go insane with all the anxiety and depression and, and wasn't sure what my body would be doing. And it's pure magic when you can hold fear's hand and step forward and ask the uncomfortable questions, have the test done, get the results. Nothing is a label or limit until we make it one. It's just simple data collection. And if we could all collectively go through and have a data collection on how our body's functioning and what's happening with us, then we actually wouldn't have that excess stress and all the narratives circulating in our brain, because we have the data, and it's just science. That's all it is. So I'm all about science is my favorite. So I could go on for hours.
Beautiful. Thank you so much. Thank you, our guest. Thank you for sharing your knowledge and experience today with our attendees. Yeah, this is an awesome discussion. I think that we should have more of those. Now it's the time for questions. Let's see what our attendees. So if you haven't posted your questions yet, please do so. Use our Q&A box to ask your question if you have any. Oh, so here is a question from one of our attendees, and I guess this is for you girls, so whoever wants to answer. Did you have to take some time off while doing egg freezing? Who wants to take it? Dana?
I did mine. I mean, I was still in the classroom at the time, so I did it over the summer. I strategically did that, but that was my choice. And I honestly, I would encourage taking a little bit of time off, just because you don't know how you're going to feel. You don't know. I mean, I felt wonderful the day of, and then the next day I was exhausted. So you just don't know. So it's better to take care of your body give your body, I mean, you're making this journey for yourself, right? And so to give yourself as much grace and space as you need is my suggestion, if you can.
Dr. Zarek, what would you say from the doctor's perspective? Should we take a break?
I completely agree with Dana. We usually say take at least 2 days off post egg retrieval. It is minor surgery. You just don't see the incisions, but they're incisions that are healing overall. And every day does get better. So after about 2 days of being kind of completely off, if you feel like you go back to light work, that's great. But really the full recovery, it's actually more like 2 weeks because the ovaries have grown in size quite a bit. And it takes like a good 2 weeks for them to shrink down back to normal size.
Interesting question about birth control. So I guess that's again for you. So can you still do egg retrieval if you do not want to take birth control?
Of course. Yeah. We have lots of ways to work around that.
So there is a follow-up to that. So I do natural family planning for birth control, and I do not want to take chemical hormonal birth control. So is there difference between what birth control you're taking?
There are differences with the different birth controls. We use low dose birth control pills and the active dose, and that's really just to kind of time a menstrual cycle into the IVF, the kind of the egg freezing calendar schedule, but it's not required. I would say what is more required is those stimulation medications, because you really want to maximize the number of oocytes that are retrieved. Otherwise, I would be retrieving only one egg.
That makes
I can
sense.
quickly add to that because I was in a similar situation. Like I did not take any hormonal birth control to start this process. It was not recommended by my specific doctor. And I'd been off hormonal birth control for almost an entire year at this point. And I also do cycle tracking and temperature measuring for birth control. So if that's helpful.
Yeah, it is. Thank you for sharing. So there is a question about the price. I guess I can take this one. So what is the total price of egg freezing with all the meds and fees? And can I do financing? So that very depends on the clinic. So different clinics have different pricing, and you should be very careful because so usually the pricing shows only the medical bill, but then you have also the medication. The medication is a little bit of a variable here, depending on how much medication you need. But on average, I would say that the prices start from $4,000 per cycle, and they can go all the way up to $15,000. And Oma Fertility is a great actual example because they have very reasonable pricing, and this is the whole idea of the clinic. So they have very reasonable pricing, very good professionals, but very, very good pricing as well, and financing as well. So the medication can be anything from $3,000 to $10,000. So to keep in mind, this is in addition to the cycle cost.
If I may add,
yeah,
the
please.
facility also has a shared egg freezing program. And so if you're struggling with getting the funds for an egg freezing and the medications, you can kind of keep half of your oocytes and the other half are putting to an egg bank. So you're a donor as well as for your own patient within one cycle. And that's all free.
So that's another option for people who are considering donation. So yeah, here you can get it for free and you can share it off of your eggs. Another question is about freezing abroad. That's I guess for me as well. I've seen on your Instagram the interview of a woman who froze abroad. Is it a good option overall? It seems much cheaper. Dr. Zarek, do you want to comment on that before I start?
Well, so it's interesting. This is a great question because one of my first oocyte freezing consults I did with Oma Fertility was a local St. Louisan who was about to go to Bulgaria for egg freezing, found us, and then was able to have the egg freezing here at home. And so I'm really proud that we're able to provide something that's more affordable, and traveling is great, highly recommended. It's just that once you've done the egg freezing abroad, your oocytes are abroad, right? And so then, you have to go to them, and you don't necessarily know when. And so there's just simply the ease of finding a clinic closer to you. And there's lots of clinics, and there's really great fertility care. So I would say that's one piece of advice, is you will be very well supported. Just go with your gut in terms of who is the right kind of clinic and team to support you, because we fully expect to be available anytime you need us to make sure that you have the best experience possible.
Yeah, so I just want to suggest to everyone who's considering freezing abroad to really do your due diligence on the clinic, and don't go to the countries where you don't know the language or you don't know anyone, because it's still a medical procedure. Something can happen. You want someone to be there. You have to be there at least for 2 weeks, better for a month. This is not a thing. So it is cheaper. This is true. But there are some considerations that you should take, like so the doctor, where you're gonna stay, because there would be additional cost for your traveling and etc. I would not recommend remote monitoring, because as the interview that you mentioned, a woman in this interview, she went to Italy, but she was doing remote monitoring here. And when you do not the full thing with the same doctor, things can go wrong. That's what happened in her case. So I would suggest to do everything with the same clinic, because that would make a difference. I think I'll wait. We have more questions. What will happen to my eggs if I don't use them after freezing? Dr. Zarek.
Will remain frozen for a long time, which is why it's important to have some version of a power of attorney or just some legal document in terms of what to do with your oocytes if you do not utilize them. Otherwise, we're instructed, we don't touch them until you tell us what you want to do overall. You could donate them. That's one possibility, but they are yours, and they still, even if they've been frozen for 2 months, 2 years, 20 years, they still generally thaw very well and can make a really great embryo and baby.
Yes. So you basically would have a few options when you will be signing your agreements with the clinic, what you want to do with your oocytes after. So you can donate them for research, you can donate them to other family, you can discard them. So it's up to you to decide what you're gonna do. But they can stay there in the storage for a very long time. I think that's all the questions actually that we have. I want to say thank you to all of you for joining us today, for sharing with us, and because I think that helps a lot, and we are creating these webinars to really increase awareness, so that women know that there are fertility options that they can use, and there is such thing in egg freezing that can actually help if you plan to start your family later. We encourage everyone to go to see fertility doctor and to get tested. And if you need any help, we are happy to help you. Please reach out to us at Blooming Eve, or go to Oma Fertility to get tested. Thank you, girls, again for being with us tonight, and everyone have a great, great evening.
Thank you.
Thank you so much.
Thank you.
Bye.